This video will teach you the OMM technique known as the scapular lift. The purpose of this technique is to increase myofascial release of the shoulder girdle and also to treat rib dysfunctions. Before you get started, you want to ask your patient if they've ever had any history of shoulder problems like bursitis, tendonitis, rotator cuff injury, shoulder dislocation, etc. Usually you know about your patient's history, but sometimes it's always good, especially with new patients, to ask. Now, to actually carry out the treatment, you want to have the patient lay on the opposite side of that which is being treated. So since I'm going to treat the patient's left scapula, I'm going to have the patient lay on their right side. You'll then have the patient stick their left arm behind their back. And I'll come through here underneath the arm onto the scapula, which you'll notice when you're doing this is now nicely winged and easy to grab onto because the patient is doing this with their arm. If the patient wasn't doing this with their arm, it'd be very difficult to grab onto this medial border of the patient's scapula. However, since it is nicely winged, I want to grab onto that medial and maybe even a little bit of the inferior angle of the scapula. Just grab onto that scapula so you have a nice hold. You then take your cephalad hand, and put it onto the patient's shoulder. Now what's going to happen is the patient's going to inhale deeply, and I'm going to push down or caudally with my cephalad hand. So I'm going to push towards the patient's feet like so, and I'm going to lift up or expand and try and pull on that winged scapula. So the patient just breathe in, go ahead and breathe in, and I'm pulling up, and as the patient exhales, I'm going to maintain that traction down and out. So down with my up hand, and out with this hand, the hand on the patient's scapula. The patient will breathe in again, and it'll expand that space, and I'll hold it as the patient breathes out. You're maintaining traction and trying to spread out that person's shoulder girdle, the patient's shoulder girdle, and their scapula. Again, this treats rib dysfunctions and incorporates myofascial release of the shoulder girdle. You'll want to do it for about 5, maybe 3 to 5 really good deep inhalation-exhalation cycles. And make sure during each inspiration and expiration that you are following into a full stretch down and out. And that is the scapular lift.